A healthcare home is a model of care that provides additional care coordination support to existing patient care teams. This interdisciplinary approach to patient care allows for increased team communication, access, collaborative care plans and goals, and quality improvement.
All patients that come to a healthcare home certified clinic belong to a healthcare home. Some patients need additional support and are enrolled in active care coordination provided by a community health worker, a clinical care coordinator, or a social worker.
So we as healthcare providers are increasingly aware that social determinants of health often precede our ability to achieve optimal health outcomes in our patients. Our relationship with our community health workers are really instrumental at evaluating a patient's acute social needs and aligning those needs with the available resources in the community, as well as within their social networks. As a result, patients are better positioned to attain improvements not only from their overall health perspective, but also their social perspective, and as a result, they're able to return to more productive lives in our community.
Community health workers are dedicated individuals who serve as a bridge between the patient and their medical services. We assist in identifying the need for other members of the care team to be involved in the patient's care. The trusting relationships that we develop with our patients allow us to understand the barriers they face every day.
We listen, speak the language, not necessarily a different language, but also a culture or community, meeting the patients where they are at, to help expand their connection to medical care and overall basic needs.
Hi, I'm Becky, one of the dietitians here at HCMC. I see my department and the community health workers as complementing each other. I might provide the primary nutrition education, but then I might refer out to the community health workers for just additional support, maybe some education, some health coaching. We have approved all of their education materials and I'm really impressed with what I've seen so far. The community health workers can give much more frequent follow-up than I could provide. They can also help patients get the resources they need. I just think they're a great part of our team here.
We do speak to the needs of the patient by listening, advocating, and including their voice in the treatment process. We listen to facilitate change, however big or small, and celebrate the baby steps as well as bigger goals. We often look like them, shop, play, work, and worship in the same communities, thus having an inside knowledge and viewpoint to better be able to meet the patient where they're at.
At Hennepin County Medical Center, community health workers are based at primary care clinics, as well as out in the community, such as homeless shelters and the adult correctional facility, to assist patients in connecting and accessing primary care services. Community health workers can work in many different settings. Traditionally, they have been an extension to the medical community, working in and with the communities they serve. Community health workers are not medically trained. They are trained through an academic credit certificate program to provide functions of care coordination, education, and advocacy for individuals and communities. Through the Minnesota Department of Human Services, community health workers can provide diagnosis-based education services for patients.
CHW support and enhance the work of other members of the care coordination and medical team by managing the logistical and practical details of care delivery. Although assessment is not the role of our CHWs, they are often one of the very first team members to become aware of a patient concern or a barrier that could get in the way of the patient's ability to access care, the care that they need. If it's something that a CHW is able to address immediately, they're so good at handling issues on the spot. But on the other hand, if it's an issue that involves the expertise of another team member, they're an excellent bridge to other resources, both within our hospital setting and also in the community. And because of the CHW's firsthand knowledge of the community and its resources, they're also able to provide health education in a way that's meaningful and relational and relevant. Because what I know about the CHWs is that they're so good at meeting patients exactly where they're at. I truly believe that we're able to get to the heart of a patient's concern more effectively and respectfully because of the presence of CHWs in the clinic and throughout the hospital.
CHWs work side by side with providers and patient care team members to identify patients that are struggling to manage their health conditions. We meet with patients during their appointments to identify the goals that they have and work to align them with their medical goals. We work closely with our patients to help them navigate the healthcare system and connect them with community resources that would be most helpful.
At HCMC, community health workers work as care coordinators, making sure that the patient's care plans are followed, keeping permanent contact with patients, and following up after events such as hospital discharges or emergency room visits.
CHWs are a point of contact for patients, someone they can reach directly through a phone call, an appointment, or a message through MyChart.
However, the most important role they play is in developing trusting relationships with patients to empower them with the knowledge and support they need to be healthy.